administering over 8,000 doses to patients every day, 365 days a year, of over 500 different types of medication. The ability to get the 5 rights, the right patient, the right route, the right drug, the right dose at the right time is critical to ensuring these patients get the right treatment.
So our system right now is very time and labor intensive. If somebody needs something right away, which is what we call a stat medication, we need it right away, we would fax that down to the pharmacy. The pharmacist will look at it. We still need to fill it. They have to get a porter. The porter has to bring it to us. So there's still a delay.
We want to be able to make these innovations, which requires the equipment, which requires the funding, and we need the Hospitals of Regina Foundation to make this available so that we can improve the care that's provided to patients in this region.
What we really are looking for is an IV robot to help us prepare IVs. Right now we're making somewhere in the neighborhood of 700 IV doses a day. That's taking us 5 staff members, at least, sometimes 6 and 7, depending on how complicated that is. An IV robot will reduce that number of staff required to make those same doses at least as accurately to probably 2, allowing us to redeploy the other 5 to 7 people in direct patient care activities like medication reconciliation. Additional to that is the Pyxis machines, which are on-unit storage devices, which allow us better control of the medications, safer accuracy, easier access, and faster delivery into the nursing unit, and allow the nurse to get those medications as soon as they're ordered and approved, ready to be dispensed right to their patient.
I mean, I work in a cardiac care unit. We have emergencies. There's times we need to give things to people very quickly. So when it's an emergency, I can get what I need right away, which is a huge difference.
Time saving with Pyxis, a number of things happen. We have the nurse have the ability to give that med when they're ready to give it. It saves waiting. It will say, again, we can take that medication out of the Pyxis machine in under 30 seconds. If that dose comes from pharmacy, that can take up to 2 hours just for the medication to arrive.
It would make a difference for nurses too, because we won't be concerned about making sure that, you know what, we might pick the wrong medication or we might have something that would go wrong. Pyxis won't let you do that. Pyxis says, you want this medication, it's in this drawer, and it pops that drawer open for you. You can't take the wrong one because the other drawers aren't open. So it's like a safety mechanism. It's like a built-in safety for people. This is a really good opportunity for you to help us. One of the things we would love to do is make sure that we can give medications in the best and safest and quickest way that we can. So your donation would let us buy a machine that would make it safer for nursing, it would make it better for the pharmacist, and it would ultimately mean that patients get what they need each and every time they need a medication. Your donation is going to make it possible for us to buy those machines, to have those things that are so important for patients, good care, safe care, every time.
So to everyone who is considering helping the Hospitals of Regina Foundation to help your hospitals in Regina Qu'Appelle Health Region, but can only get with the funds that you provide, that we are going to provide safe and effective medication therapy for all the people that we have the privilege of treating. That could be you.